As an emergency clinician, you should be able to do a fascia iliaca block for a neck of femur fracture or sometimes an intertrochanteric fracture. Let's talk about this. After making sure that this is the right patient, you've looked at the x-ray and identifying the correct site, of course the consent and appropriate positioning of the patient, you need to use the linear probe of the ultrasound. Place this horizontally in the groin of the patient on the affected site. Start by identifying the neurovascular bundle, and from medial to lateral you should be able to see the femoral vein, the femoral artery, and the femoral nerve in that order. Bear in mind that the fascia iliaca comes from the lateral aspect of the screen and sits on top of the femoral nerve. Here is a picture of the relevant sonoanatomy. I will label the fascia lata over here, and then the sartorius muscle. Beneath that is the fascia iliaca, which is our target, and beneath that is the iliopsoas muscle. Consider an in-plane technique where the needle comes in from the lateral aspect of the screen. Once you pierce the fascia iliaca and start injecting the local anesthetic, you should see an unzippering of the iliopsoas muscle from the fascia iliaca. This confirms that you are in the correct place. The dose of bupivacaine to use is 2 milligrams per kilogram, but BNF recommends that you can use up to 150 milligrams when you're using this as a regional anesthesia. Now, of course, no procedure comes without its complications, and the complications of this procedure are bleeding, bruising, infection at the site, worsening of the fracture, which is very rare, and then, of course, an intravascular injection of the local anesthetic, which can result in local anesthetic systemic toxicity, for which you should be prepared as well. Thank you so much for watching.